Welcome, and thanks for joining us to help choose home when care is needed. A podcast all about the benefits, value, and safety of receiving care and services in the one place that feels most comfortable, wherever it is that the person needing care calls home. I'm your host, Marilee Orsini, and I've been involved in healthcare at home since 1981. Before we meet today's guest, a brief thank you to our sponsors and partners, the National Association for Home Care and Hospice, Access, and CoreCute. Today's episode is number 6 of Season 4. Our guest today is Brent Korte. He is the Chief Home Care Officer for EvergreenHealth, which is located in Kirkland, Washington. Brent is also very active in the National Association for Home Care and Hospice. And on a personal note, which we will not talk about, he is an avid mountain climber. Please help me, won't you, and welcome Brent Korte to Help Choose Home. Well, Brent, first, let me say thank you so very much for joining us today. It's really a pleasure to see your face and also to hear you. So let me start off with talking a little bit first about Evergreen, because that's where you spend your days.
Great. Thank you, Marilee, for inviting me back. Excited to join from today, very sunny Seattle area of Washington State. We endured the first of not only the COVID pandemic, but also a very long and cloudy last X amount of months. So we're very excited to get some sunshine and be out and about. EvergreenHealth is a not-for-profit, community-based hospice and home health provider. We take care of over 2,000 people on a daily basis and work very hard to be an innovator in the home health industry, in the home care industry, and in the hospice industry. So I'm delighted to share what's happening here in the Pacific Northwest with Evergreen and hopefully provide some perspective on the home care industry nationally in general.
Good. Yes, I would like that. You all were fortunate enough, and I say that sarcastically, to be slammed with COVID, one of the first areas in the country. And I know you've not only survived that, but used a lot of innovations to get through it. And I would just like for you to reminisce on that a little bit and talk about how home care will change and has changed as a result of those experiences.
Yeah, great. Hey, great question. You know, in some way, we were probably very fortunate that COVID came to our community very early. That is because it forced us to figure out exactly how to work through these challenges, and also allowed us to share very early the best practices that we were working on literally in the moment to try to make sure we maintained patient care and kept our folks safe. So COVID came to Kirkland, Washington, where we're based. Sadly, the first death in the United States was at the hospital system where Evergreen is part of, and we had the first hospice patient die on our census, and what we think is very likely the first dozen or so home health patients, and that really forced us to innovate early. It was a tough time. I can pretty confidently say the toughest of time for our staff, but as with any good team, when you're surrounded by excellent folks, they lift you, they lift leaders, they lift patients, they lift themselves. And we were locked arm as a group and really, really found our way through perhaps the toughest of times. Through COVID, we realized that on March 1st, 2020, America became homebound. And in the same right, I believe that as of that moment, home care really is now on the map, for lack of a better way to put it. People who generally would have been sent to hospitals couldn't go to hospitals because hospitals were overrun, and frankly, they didn't want to go to hospitals. I think you'll hear throughout our conversation today a theme that many folks prefer to not be in hospitals. And if you look at the healthcare economy in the United States, it's a vast economy, it's dynamic, it's super complex, but there are some drivers to that economy that simply don't change. And here's a few of them. People don't want to spend too much money on healthcare. People want to be informed, and they want to have a say in their care. And then finally, people don't want to be in the hospital. They want to be home. And it could be that COVID allowed our nation, 330-ish million people, to realize that they, in many cases, could be at home and stay healthier by virtue of staying at home. Now, there are many exceptions to that, and people need to go in the hospital. And of course, a lot of people, sadly, we've lost hundreds of thousands of Americans to COVID-19. In the same right, if we can look at the silver lining of this terrible pandemic, it could be that the healthcare economy is amidst a shift. And that shift is that this enormous hospital industry, $1.7 trillion is the U.S. hospital industry. So if you think about the enormous number, the home care industry is maybe around $100 billion. So the numbers there, it's essentially significantly larger. I'm not doing my mental math there, but significantly larger. I think 17 times larger. But the majority of consumers really do want to stay home. So if we just briefly think about a patient who has a serious illness, perhaps they would be on what we call palliative care. They may be inside a couple of years left of life. It's at that point in their life that healthcare spending skyrockets while their quality of life decreases. Home care is the fix to that. And how is it the fix? The multiple appointments and the multiple interaction and the paperwork and the bills and the confusion that come with a lot of those interactions that happen in hospital setting, a lot of those interactions may not be necessary. And I feel like people are perhaps waking up to the idea that if they're able to stay home and live a higher quality of life near their end of life, then everyone wins. The healthcare economy wins, they win. And that even doesn't even count folks that are not in the last couple of years of life. Many people are just saying, it's not necessary for me to go find parking, walk in the hospital, get lost when someone can come to my home. So
I'm going to dive a little bit deeper into that, because I think the fact that people got used to, what we're doing right now, we're talking virtually. So we're on Zoom and we're talking, and doctors are now seeing patients virtually, and physical therapists are seeing patients virtually when they need to. So talk to me about how that expansion of what I'll call telehealth or telemonitoring is actually going to take us into the future based on what we experienced during COVID.
Yeah, wow, great question. I think for many of us, myself included, we have experienced virtual care on our couch, or we've experienced virtual care at home. For me, I actually experienced, oddly enough, I worked about 4-minute walk from a hospital, and I did a virtual visit myself through a company called 98.6, and got a script for something that saved me from having to walk over to the hospital. Virtual care and technology is only going to augment and complement home care. There are times when you're going to need to, in my opinion, you're likely as a healthcare consumer, a home care consumer, are going to need someone to come in your home. One good example would be if you've had a knee replacement and you need manual therapy perhaps, or you need a situation where a physical therapist would come in your home and literally manipulate your knee to stretch it out and help you gain better range of motion. Well, that needs to be done by an individual. The good news is there's a whole army of extremely talented physical therapists that are ready and able to go into your home. They're used to it. They understand how to respect your space and also how to get you healthy. However, that next visit may not need to be in person. You may be able to reach that same physical therapist through a tablet or even through your phone, and she or he could help ensure that your range of motion is progressing. Make sure that you're doing your homework on your stretching and your leg exercises, etc., and then schedule your next appointment. And it can be done in a manner where your visit time, the time that you are experiencing healthcare, is the same amount of time. Maybe it's 45 minutes. They'd be in your home for 45 minutes, or you'd be on a telehealth visit with them for 45 minutes. But you don't need to drive now. You don't need to get in and out of your car and get out. If you just had a surgery, get a 4-wheel walker or a cane, you do it from your home, because the home is the environment that you need to adapt to most quickly. And when they're there, and when they're seeing you virtually or in person, you are going to benefit because you're not in this ultra safe hospital environment where everything's removed and there's no trip hazards, et cetera. And last time I checked, the average home has a lot of rugs and many pets and a lot of things that can kind of act as hazards to you. So I can't wait to see what innovations come with telehealth in the future.
But that is a very interesting perspective, because understanding that adapting to the home is what the goal is probably what home care should be all about, but we haven't, in my opinion, had that partnership from the hospital to home before that we now have.
Yeah, I would have to agree. And again, you walk into a hospital and a hospital is there to provide an intervention or a surgery or some sort of interaction that is meant to help you. But your healing, your treatment happens in the hospital, but your healing occurs in your home. It will always occur in the home unless you want to stay in the hospital for months on end. And I don't think I'd be surprised if there's a single person listening today that would want to do that. I know I wouldn't want to do it.
I think that's true. And I said the magic word. If we were on the old Groucho Marx show, the duck would have come down, but the hospital to home word. And I know that's a buzzword now in the industry, and you all are just getting into hospital at home. But for our consumer audience, could you talk a little bit about what that means?
Yeah. So the goal of hospital at home is essentially to work with older adults to provide hospital-level care to acutely ill folks in their home in a way that will effectively keep them out of the hospital. It's an interesting concept, and you'd think, well, how on earth am I going to get the same amount of care with all the machines and the monitoring and the physician walking in and the nurse walking in and the CNA and medical, all the folks that come in to visit you? So the theory is this, that those things aren't all necessary. The theory is that you can save costs up to 30% cheaper for the healthcare system, at least, by virtue of the patient being at home and receiving hospital at home care versus doing so in the hospital environment. Now, it's very early in the industry. Johns Hopkins, I imagine most people have heard of, out of Baltimore, is a leader in this, and they are really doing some amazing work, and the outcomes are showing that folks are getting better treatment and their length of stay in the hospital is lower. So it's just sort of a all around good thing. All that said, it's just the big test is coming as more people. Yeah.
Well, as the demographics move with more and more people needing care, I'm excited to see that there are innovations happening in the industry and that we're well aware of the fact that those care needs are going to increase, or we're going to have to do things differently.
Yeah. 100%.
Let me switch gears here a minute and talk about, you're very active with the National Association for Home Care and Hospice. And I would love for you to talk about your role there and how you see the industry nationally moving to be more patient-centered.
Yeah, great question. So colloquially called NAC, or the National Association for Home Care and Hospice, I've been very fortunate to be part of their governance and leadership structure on the board of directors for the last 5 years. This is my last year. I'll be at the end of my term at this year and the end of this year. So my role is I'm secretary on the board, but also the chair of the governance and nominating committee. And this is a role that I take very seriously. The governance and nominating committee itself is an excellent group of leaders in the industry from around the United States that really are tasked with a couple things. One, making sure that the bylaws of the industry of NAC that supports the home care and hospice industry, that they're well written and sound. And there's a lot to that. But number two, it's ensuring that we find and nominate and fill future board positions so that the governing of the industry leading trade group, NAC, is well situated. So what we've done is really try to work towards a couple of things. One, as an association, I feel like NAC has done an excellent job pushing for innovation. That means being proactive legislatively. It means working on workforce challenges. It means meeting the needs of U.S. consumers through equitable provision of care. And what I mean by equitable provision of care is that equality within healthcare is one thing. The concept that everyone should have the right to receive a certain amount of healthcare, but equity in healthcare is different. It means that the individual should have the right to receive the care that they need that will make them healthier. And that's where home care comes in. I think NAC understands that very well. When home health, when home care, and when hospice have the ability to go into communities and provide care at the community level, it means that we are meeting consumers from all diverse cultures and backgrounds, you name it. And we're able to go in and provide care to folks on their terms where they live. We talked about the rug earlier. We talked about, the cat running under your legs at the top of the stairs. Well, when we're able to be there and in the community and provide care to folks in the community with a workforce that reflects the community they're serving, that in and of itself, I think, is a strong innovator. And NAC is pushing very hard to do that, meeting the needs of diversity, equity, and inclusion. And also, again, pushing for common sense legislation to make sure that home care is paid for. It for the layperson, there's an economy within every type of provision of healthcare. So surgeries have a specific economy. Hospitals have a specific economy. Well, home health and hospice, home health in particular, is a very difficult from a business perspective. It's just a difficult business to run. It's very, very low margins, very difficult to run well. Well, NAC has worked very hard to make common sense changes that do two things. One, they help the healthcare consumer, but two, they allow businesses to be able to run. I mean, heck, we're not for profit, but that doesn't mean we can operate without making a profit, right? So we really appreciate the work that NAC's done. I think under the leadership of Bill Dombey, NAC has thrived, and I look forward to what NAC will come up with in the coming years. Even though I'll be off the board for at least a period of time, I know the board's in excellent hands.
I look forward to that as well. I've always loved following NAC, and they do seem to be ahead of the industry right now and sort of pushing as opposed to following. So that's a wonderful report from you on that. Brent, we're nearing the end of our time here. Is there something that I have not asked you that you thought I was going to that you would like to talk about?
Just a couple comments, if I can make, about expectations. For those of you that haven't received home care, or those of you that are curious, what is home care? Is, someone going to be coming in my house and you're just not used to this concept? Just know this, that the home care industry is innovating and moving at a lightning speed. They're finding new ways to meet patients' needs and to keep you as a patient safely at home. So this is done whether it's through new technologies or just innovating the way that home care is provided in general. So what should you expect? Expect talented clinicians, the best clinicians. Home care, if you think about where a clinician wants to work, they want flexibility too. And home care does offer some flexibility to a working parent, to a working mom, to someone who may be a little later in their career and maybe wants to work 4 days a week versus 5. So you have these folks that are really competing for jobs that are most flexible. Home care offers that, which means it translates to top talented clinicians coming in and out of your home. I would also say expect to stay in your home longer as home care is meeting the challenges of sicker patients. So if you aren't comfortable as a healthcare consumer with your parent, your sibling, your child, you name it, going into a congregate setting, into a facility, then look for home care and see what home care can do. You might be surprised. And then expect to welcome a diverse and talented, again, like I said, talented, but a very diverse set of folks in your home. And then lastly, expect to learn a lot about how to take good care of yourself. And the idea is that you stay home, lead a healthier and longer life. And we want to be part of that.
Wow, that's wonderful. I could bottle that and make that an ad for home care. So thank you very, very much. That was good. It's always a pleasure to see you. And thank you so much for your time. I know it's valuable, and I look forward to more conversations in the future. Thank you, Brent.
Likewise. Thank you.
Bye.
Yes. Bye.
Thank you so much for listening today, and a special thanks to our sponsors and partners, the National Association for Home Care and Hospice, Access, and Core Cubed. If you've not done so already, please subscribe to our podcast and take the time to leave a review on Apple Podcast. We are now also on Spotify and most other places where you find podcasts. Like and follow us on social media and join us, won't you, to spread the word and help choose home when care is needed.